Hello, everyone. Thank you all so much for joining this session today. My name is Neil Vora. I'm a physician with Conservation International, where I help to implement environmental conservation solutions to improve human health. Prior to joining Conservation International, I worked for the U.S. Centers for Disease Control and Prevention for nearly a decade, where I focus on outbreak response to emerging pathogens. We are unfortunately currently witnessing massive environmental change around the world, from a changing climate to worsening air quality to collapsing fish populations. These changes make the state of the global environment indeed seem dire. Just look at the latest warnings from the Intergovernmental Panel on Climate Change, which state that we are on track to have 1.5 degrees Celsius of warming within 2 decades. Then, of course, there is infectious disease emergence, which has been linked to environmental degradation. COVID-19 is the latest in a long line of novel infectious diseases to have recently emerged and has inflicted immeasurable suffering. The bottom line is that human activities are behind these environmental degradations that we are seeing globally. Indeed, as described by Sam Myers of Harvard, we are in a new geologic epoch called the Anthropocene, in which humans are the dominant force driving the planet's biophysical conditions. And particularly over the past century, many humans have participated in extensive resource extraction from the earth. And while this has certainly resulted in direct benefits to a large number of humans, such as longer life expectancy, we perhaps have now reached a tipping point in which the scales are beginning to flip. Right before our eyes, we are witnessing how the declining global environment is adversely impacting human well-being. And recognizing the linkages between human health and that of the earth is what the fields of planetary health and One Health are all about. And this is also the focus of today's conversation. So before I proceed, though, I want to allow my colleague Sophie to introduce herself. So Sophie, I'll turn to you now.
Yeah, thank you very much, Neil, for the introduction. Very nice to see so many of you here this morning. I'm Sophie Gepp. I have a background in medicine and I have an MSc in public health. And I'm currently pursuing my medical doctoral thesis in the field of climate and health at Charité University Berlin and the Potsdam Institute for Climate Impact Research. I'm also an active member of the German Alliance on Climate Change and Health and have been working on climate change and health both in Germany and internationally as a consultant in climate change and health. And I'm very much looking forward to the discussion today. And yeah, back to you, Neil.
Great. And just some housekeeping stuff that I neglected to mention before. As we are having this discussion, I welcome all of you in the audience to please ask questions. You can use the chat function to do that. We welcome you all to have an online presence as well, so you can comment using Twitter with the hashtag HCBerlin. And in terms of accessibility features, live captioning is available. The link is found in the reception area. If you have any questions about this, there's a help desk in the session area as well that can help you navigate that. And so with that, please let's start our discussion. And again, we want this to be interactive with all of you in the audience, so please ask questions. Sophie, can you tell us more? What is the field of planetary health about? How long has it been around? And what does the field aim to do?
So very much in short, I would say planetary health is about healthy people on a healthy planet. So to be healthy as people, we need a healthy planet. And it means that our health is dependent on and linked to the state of the natural systems. I think the vision is relatively young compared to older concepts. There's been around eco-health and other concepts. And there's, of course, been a lot of traditional knowledge around that since many, many, many years and centuries knows that we are very close to nature and to natural systems. But I also like very much that planetary health also provides a positive vision. We can have a healthy life within planetary boundaries. And while this is a challenge, maybe that's a good thing to imagine. How could our life look like if we have a healthy life within planetary boundaries?
Thanks, Sophie. And can you say a little bit more about planetary boundaries? That's a concept that might not be familiar to everyone.
Yes. So I think in 2009, The concept was first defined by scientists, including Rockström, and there are several planetary boundaries which we which are important for us to be living within. So one of them is climate change, and it's been probably the most prominent boundary that we all know, but there's also biodiversity, which we can probably talk about later on with relations to pandemics and zoonosis. But there's also other things like nitrogen and phosphorus cycles, which I know very little about. Yeah, I can pop the link into the chat and you can have a look. I think not all of this is very intuitive for us, but it's important to keep in mind that there are other boundaries than climate change that we have to respect. Otherwise, it's going to be very difficult for us to live in these environments, and we also may reach tipping points that we can't go back from.
Thank you, Sophie. And you mentioned climate change. So I was hoping we can dive a little bit deeper into that. In what ways does climate change impact health?
Yeah, I think there are so many different things, and I'm going to dive into them in a second. But I think there are very few parts of our health and our life that climate change won't touch. So it's maybe the other way around. What will not be impacted is very hard to answer, and it's often looked at as a very technical issue. But I also think we have to be increasingly aware of that it's going to be a social and a societal issue that will affect us quite a lot. I'm going to dive in a little bit in how climate change affects health through various ways. So on the one hand, there are very direct impacts, which are extreme weather events with injuries, fatalities. We have heat stress, and we know that during heat waves, mortality rises quite a lot. We have more presentations to the emergency rooms. We have increased mortality, for example, of cardiovascular diseases. And these are kind of the things that come in waves as kind of special shocks. But there's also continuous exposure. For example, if we have pollution, which itself is not due to climate change, but it has a common driver, right? Pollution and climate change has the common driver of burning fossil fuels. And this is more of a silent killer. So we have people with respiratory illnesses that suffer from these, and we also have exacerbations of asthma and other respiratory diseases. And
sorry, go on.
Sure.
Please.
And we can also, I think you can talk a bit more about that. We have in water quality, we have more infectious diseases due to changing climate, and we also have more vector-borne diseases. And eventually also, we have to face the fact that we will likely face food supply and safety issues. And this will also come with all the effects that we know, like undernutrition, etc. So yeah, I think these are only the direct and indirect effects, and these will lead to a lot of social and societal factors that are downstream, like conflict and forced migration. So I think it's quite from very direct effects to large-scale societal effects, it will affect all of it.
Thank you, Sophie. And I really like the way you framed it, that in what ways will climate change not affect our health? Because I've never heard it flipped around like that, and I think you're entirely right about that. In fact, the Lancet and even the WHO has come out with statements that in the next century, climate change is the greatest threat to human health. You know, we're in the midst of this horrible pandemic right now, but we also have to realize that there is another crisis that is actually already underway and is only going to get worse in the coming years. And just to lend my personal voice, because we have an amazing audience who many of the people in the audience have responded to some of the most dire situations in the world, whether disasters or natural disasters or war. You know, as a physician, I've had the opportunity to do some disaster response myself, including to hurricanes. And these are events, the devastation I have seen from events such as hurricanes are things that are only going to get worse. And you brought up the point about mass migration. We're going to be seeing massive movements of people beyond what we're seeing right now, driven by shortages of water, shortages of food, unstable living conditions. And so we really have to brace ourselves for things getting worse. And I think there's a message of hope here as well, because we are on track, certainly, to have 1.5 degrees Celsius of warming compared to pre-industrial levels in the coming few decades. But we can hopefully limit that through concerted global action, which brings me to my next question for you, Sophie, about COP26. What is COP26? What are they discussing? And are they going to be talking about health during COP26?
Yeah, so COP26 is the conference of the parties. It's the biggest climate change conference where leaders from all over the world will meet to discuss the agreements they made, and specifically many agreements within, or many top points within the Paris Agreement that you might know that we came to, which is telling to limit global warming to well below 2 degrees, preferably 1.5 degrees. And so this year's discussions, as always, will be very technical. It will be about finance, about transparency mechanisms. So it's getting very nitty-gritty. But I think health plays a twofold role in this context. So first of all, there are going to be health events there. And the WHO published a report naming it the health argument for climate action. And I think that's a very good way of phrasing it. So health can be a very strong argument because people see health is very close to people. It's not somewhere the iceberg that is melting, but it's right now my health, the health of my family members. And so health can provide a very good argument for immediate climate action, also because you can see in some climate action, you can see immediate health benefits as well. So if you limit pollution in the city, you can see immediate effects on people. So I think health can be quite a good argument there. The health events will be, so there will be, WHO has a health pavilion where there will be over many days, health events there. On one day, there will also be a special session dedicated to health. There's also, the UK has something called the COP26 health program, where they urge or encourage country leaders to sign up to specific actions with a focus on health systems, but also on adaptation. And there will also be kind of side events. So there will be the Global Conference on Climate Change and Health, hosted by WHO and the Global Climate Change and Health Alliance on the 6th, I think. And on the 7th, there will be a People's Health hearing, which is seeks to bear witness to the public health impacts of extractive industries and create a space that connects to people's struggles and set out a vision for intersectional transformative climate justice. So I think health will be present. That being said, I think the most important thing that can happen is strong agreements and strong ambition that come out of this. So I think Margaret Chan also said that the best public health intervention basically is net zero, or striving towards net zero. And I think that's true for COP as well. So while health is really good to have there to show the immediate effects, one of the things that would be best for health is if we have a strong agreement coming out of COP. Neil, you're mute.
There we go. I agree with everything that you just said. And I think that the health aspect of the health effects of climate change are something that, in my own observations, has only been discussed to a small degree within health circles up until recently. And I'm glad to see that major medical journals, for example, are now really taking up this cause. But the health motivation behind climate action is very incentivizing, because, like you said before, we are all going to be impacted in so many different ways, and it takes climate change for being a tree hugger issue or an environmental issue into what it actually is. And it's something that's going to affect every aspect of society. And it doesn't matter where you live, even if you are in a resource-rich country or you're in a country that has less resources. It doesn't matter about your poverty level or the access to resources that you have. We will all be affected. Of course, some people will be, unfortunately, affected more than others, particularly along the lines of privilege and socioeconomic status. But I'm very glad to see that at COP there is going to be opportunities to prioritize and to spotlight the health effects of climate change. So thank you for sharing that. Sophie, to follow up on that, you're going through your medical training, and I have been a physician for a number of years, but I still feel like we are in a minority here, right? There are not many physicians or other clinicians, whether nurse, respiratory therapists, or the many other allied professionals that we work with in a clinical setting that are talking a lot about climate change. And so, from your perspective, how do we educate more of the up and coming clinicians and clinicians who are already experienced? How do we spread the word about this?
Yeah, thank you very much. I think there has already been positive change. So we see that it's slowly beginning to be recognized. At least I can speak from the German perspective best, because that's where I went to medical school. It's starting to be recognized, and it's starting to find its way through all the bureaucratic structures, so that it's in the curriculum, and so that it has to, and also in the exams, so then it has to be taught. I think at the moment what we're seeing still is that this kind of teaching and this kind of passing on the message depends very much on a few very dedicated individuals. And I think looking at the magnitude of the effects it will have on patients, I think what would be my wish is that it's more streamlined and more in every curriculum, such as, I don't know, where other diseases are or other impacts are in the curriculum. I, for example, learned very, very rare tumors, brain tumors during my medical school, which I think you can do. It might be important, but I think if we look at how frequent the effects are going to be and how widespread, I think it's really important that we also integrate climate change effects on health in the curriculum. And so in Germany, we saw that there's quite a big need. People want to learn about this, but there's very little to offer. And we kind of bridged this gap a bit by offering at the very beginning of the pandemic, April, May 2020, when everyone was still at home and was discovering online courses, we started the Planetary Health Academy at the German Alliance on Climate Change and Health. And we had over 1,500 participants per lecture. It was amazing, the resonance we got. So I think there is quite a need. I think it's great if there are initiatives from organizations like we did, but I also think this is the beginning of a process to streamline it really into all education and also into all continuous education. As you said, we have a lot of doctors, nurses, healthcare staff out there that are done with their school but still need to be educated about this. And I feel this is something we have to take up, because they will find themselves in situations where they have a heat wave and the ER is full, and they have to have different diagnoses in mind than they used to have. So yeah, I think we have to increase ambition still, but I think we are on a good way, at least in Germany. And I know that there are international projects that also rank this, like the Planetary Health Report Card, that they ranked in the US and the UK, and I think also Canada, to kind of give a bit of a push to universities, because usually universities tend to listen a bit more when they're ranked and when they're being looked at. So it's kind of a push and pull way to do it. Yes.
Thanks, Sophie. And I really like the way that you made the point that in our training curriculums, we sometimes learn about zebras, right? So rare occurrences, which are very important, right? Because every patient that's afflicted with their illness, obviously we want to deliver the best care. But climate change is going to affect every one of us in the coming years. And it's surprising then that there's this discrepancy between the magnitude of the effect of climate change, yet how little time is devoted to teaching that in a variety of different clinical curriculums versus some of the more rare occurrences that also have very grave consequences, of course. And to dive a little bit deeper into that, do you have any thoughts about disaster response in particular? How, excuse, sorry, it's very early here, and so I'm still trying to clear out my throat. I'm in New York, but how can we make sure, or what can be done so that our colleagues who work on the disaster response side and the humanitarian side also have access to this information, and how they can become allies in the cause to address climate change?
Yeah, that's a good question. I have no experience in humanitarian context, so maybe you can add more to that later. I think having all, and I think many of the resources are open source so that everyone from everywhere can access them is really important, so that it's not behind paywalls and people can't access this knowledge. But then I also think that once we translate it into clinical practice, it becomes very context sensitive. So if we, for example, in Germany teach people, oh, now we have maybe an issue with the West Nile virus, I think other countries are like, yes, we've been treating this for years. Or maybe malaria will be a thing back again in Europe, stuff like this. And I think there are maybe two things. Firstly, really, and that's maybe making it more difficult, but it really needs to be context specific. But then also there can be an exchange. So there are countries that have been dealing with some pathogens or heat waves, extreme heat for years. So maybe we can also learn from other countries how to build best hospitals in that are good in heat waves or things like this. I think for humanitarian context, very specifically, I can't make very specific recommendations. Maybe someone of the audience has, maybe there are already toolkits out there that I don't know. Just as a general thought, I think going forward, we both have to think about mitigation. So how do humanitarian projects reduce their own footprint by local staff, local resources, which also helps decolonizing humanitarian aid, but also about adaptation. So there are probably many situations in the future where we have double and triple crises at once. So we might have migration plus a heat wave, or might have a flood and then migration and then water supply issues. I think there are going to be like crises that are adding on, and this is something we might need to prepare for more. But I'm happy to hand over to you because you have way more experience in this area.
And I, excuse me, and I have some experience in disaster response, but I really would love to hear from our audience members and get their thoughts. So again, put your comments in the chat, put your questions in the chat, because we all need to work together on this issue. One observation I have, again, I'm a clinician now working in the conservation space, but I see conservation as public health. Everything we get materially as humans to survive ultimately comes from nature. Yet we are seeing this unprecedented destruction of nature. Sophie, you brought up before about the planetary boundaries that scientists at Potsdam Institute and elsewhere have put together. There's a great documentary, by the way, on Netflix about those planetary boundaries in case people want to learn more about it. But like more specifically about climate change, if we exceed 1.5 degrees Celsius of warming, which is certainly going to happen in the next few decades, right? And the hope is that we can limit it to just 1.5 degrees Celsius of warming. But if we exceed that, the impacts of climate change are only going to exponentially increase. And we know that 30% of the solution to limit warming to just 1.5 degrees of Celsius, 1.5 degrees Celsius, comes from nature-based solutions, such as saving tropical forests, saving mangroves, saving coral reefs. Yet those nature-based solutions only receive 3% of funding for climate action. And so there's this, excuse me, there we go. So there's this massive discrepancy between the magnitude of solutions that come from nature versus how much funding they get. And that is why, hello, Chris. And that is why, let me try clearing my throat again. I'm so sorry. So that is why I think one ask that I would have of our colleagues on the call today, on the webinar today, working in disaster response, is that we become allies in advocating for nature to save people, right? We need nature to survive, whether we're talking about climate change or infectious diseases or nutrition or migration. We need nature to help us survive. And I see an absence of health and humanitarian voices in advocacy efforts for nature. There's so much more we can be doing, because when we save nature, we are saving ourselves. So with that, for a moment, I actually want to turn to our colleague, Chris Murray. Hello, I'm so glad that you're here with us today. Maybe you can briefly introduce yourself, and we can switch gears a little bit and talk about infectious diseases, which is your area of expertise.
Yeah, sure, no problem. Yeah, sorry about the connectivity issues. I'm in the Gambia, and so unfortunately, it's not too uncommon to have these kinds of issues at the last minute. So really sorry about joining the panel late, and for also missing the beginning of the discussion, so that I'm a bit, I'm not aware of what you've already talked about. So forgive me if I end up repeating anything that you already covered. My name is Chris Murray. I'm a senior lecturer at Imperial College London, where I have a lab that I call the Ecological Health Lab, and I'm also an associate professor of environmental change and health at the London School of Hygiene and Tropical Medicine, where I'm based at the MRC unit in the Gambia, which is a recent sort of affiliation that was formed by London School and this institution that's been here in West Africa for around about 70 years, funded by the Medical Research Council in the UK. My background is in ecology. Actually, I did my PhD on pandemics of amphibians, so this awful disease called chytridiomycosis, and that has sort of brought me into contact more and more with human health by this sort of conservation or this One Health type of field, where I started looking at the role of wildlife in the spillover of human emerging infectious diseases. I did a fair bit of work looking at pandemic risk and spillover and things like that. And now at the MRC unit in the Gambia, I lead a planetary health theme, which is very much in the space of what I picked up you guys were just sort of currently discussing before the time that I jumped on. So here we're very interested in this intersection between human health and the health of the environment and indeed the planetary systems that facilitate our existence, as you were just sort of mentioning, Daniel. So we have projects on climate, we have projects on biodiversity loss, and thinking very much about this kind of intersectional area, and particularly now it's a great time, and presumably this panel has timed this well with COP and everything, where similarly to what you were sort of mentioning, we kind of observed that human health is really perhaps doesn't have the voice or the presence that it really needs in the COP dialogue, and also in the text that support the Paris Agreement and things like that. And I would say equally, in terms of the biodiversity and health links as well. So that's the brief synopsis of where I am and where I'm coming from.
Thank you, Chris. And I have to say that I really admire your shirt as someone who's worked in vector-borne diseases as well. And that's, I think, a good segue to something we haven't really touched on yet, which is the connection between the state of the global environment and infectious diseases. Can you tell us more? How does a changing global environment impact transmission of infectious diseases?
Yeah, I mean that's a very, very complex area of science, and I couldn't give you a precise summary because the mechanisms and the pathways of disease are so incredibly diverse. But speaking sort of about the kind of broad narrative in this field, we can consider things like vector-borne diseases and the role of climate and environmental change in shaping the distribution or abundance of different vectors that transmit disease. And we know from observations that this is already leading to changes in disease distributions in people and throwing up new risks for disease spread, for example, into new geographical regions or host shifts. And then equally thinking about zoonotic diseases, which are those diseases that spill over from animal hosts into people. It's a very common group of diseases. Around about 60% of all human diseases have origins in wildlife, and about the same proportion are implicated in the emergence of new diseases. So these are diseases that sort of come onto the radar that haven't been observed before, or also diseases that we knew about before but are doing funny things now as a result, primarily of large global social and environmental changes. So the things that I'm kind of thinking about most often, I guess, are the role of climate in shaping the distribution of vectors and animal hosts, but also the role of land use and land use change in shaping the sort of fine-scale patterns of habitat that those hosts and vectors are associated with. And so through this sort of this melange of processes of land use change, and that brings more people into landscapes, and the idea is that increases the potential contact with vectors in some cases, and hosts of diseases in some cases, that this then becomes a catalyst for the emergence of diseases as a direct result of environmental change.
Thanks, Chris. And what about the origins of SARS-CoV-2, the cause of COVID-19? Do you have any thoughts on how did this originate? There is some debate that you see in the scientific literature and the lay press as well.
Yeah, I mean, this has obviously been a pretty big question since the emergence of COVID, and it was notable and maybe a little bit regretful that we, as the sort of eco-health or the environment.
Sorry, Chris, I think we lost you. Are you on mute?
Yeah, sorry, my finger accidentally touched the space bar there. Yeah, just sort of what I guess the hypothesis around the emergence of COVID has been there from the beginning, that it was in some way linked to environmental change, and in particular the implication of the wet market and the early cases of COVID popping up around the Wuhan wet market led to a lot of finger pointing and a lot of premature kind of hypotheses around the specific role of our actions in terms of trafficking wildlife or selling wildlife, and in this context of the market, but really what it's sort of turned out that the smoking gun is just not there yet, and we're still collecting evidence and trying to sort through the data to try to work out exactly how COVID spills over. I'd say at the moment there's really no, or really only circumstantial evidence around the role of wildlife trade, for example, in the emergence of COVID. There's a few studies looking at the general process of land use change in southern China and areas around there that sort of suggest that yes, there's an unusual amount of for example, deforestation for agriculture occurring in that area. And of course, we know that the group of bat hosts from which we think COVID has its ultimate origins are living in that area. So we've got parts of the pieces of the puzzle, but we don't have the full picture. So we really have no really concrete information about how our actions in the environment in any specific sense have led to the emergence or the initial spillover of SARS-2. But of course that's TBD, and there's another WHO team, I believe, that's been put on this to follow up again after the first one proved to be inconclusive. And so we I guess the hope is that we are able to piece together the bits of information that we have to get a little bit of a clearer picture. That I'm kind of doubtful as to how quickly that might happen, or even if it might happen in terms of finding that initial event that led from the spillover from a bat host into people.
I gather that I know that you are a specialist in amphibian diseases such as Cryptidiomycosis. We are in the midst of the 6th mass extinction, right? Where species loss is happening at unprecedented levels for recent years. And that is driven by human activities. There are many species that are going extinct every day that are increasingly endangered. Can you talk more about the connections between loss of biodiversity and the impact on human health? And Sophie, please feel free also to weigh in here.
Yeah, definitely. I mean, I think unlike some of the sort of more routine health exposures that environmental epidemiologists and others have been working on for a really long time, for example, air pollution as a sort of a single axis issue. I mean, there's multiple toxic agents that are part of air pollution sort of sphere, but at the end of the day, it's a relatively finite and concrete human health exposure, and I don't think that's the case for when we're considering biodiversity loss. I think you mentioned the fact that we're having this unprecedented extinction crisis. We're losing around about 8 species an hour, I think is the stats, and that is around about 3 or 4 orders of magnitude more rapid than the background rate as implied by, for example, the fossil record. So this is definitely occurring. The other observation I would make is that we have something like the science and the estimates are very, very wide and uncertain, but around about twice the total economic output of the planet is every year provided by nature for free, and this is what we call the ecosystem services that are related to intact ecosystems and biodiversity, and it's all of the functions and goods that they provide, including food and water filtration and clean air to breathe and all the rest of it. And that extends to every ecosystem on Earth, providing these goods and services for people to use. So when we think about like taking away some of that stuff, that's when we start to think, well, what are the implications for those basics of human life, and not just mental and physical health, but also well-being. There's lots of research to show that there's this sort of psychological connection between people's health and well-being and nature and the diversity of nature that's around them. And so if you're taking away those goods and services, then that's where we're starting to sort of see these implications for human health. And we mentioned infectious diseases being one kind of area, but this is probably one of the more difficult areas to really quantify what the ecosystem services value of nature is in terms of preventing infection. In fact, you can also see it from the other way around, that nature provides the source of most of nearly all of the major infectious diseases that impact people, and that the science is around trying to untangle how much of the biodiversity loss is actually catalyzing the contribution of these what we would call ecosystem disservices on the other side of the coin in coming to the fore and imposing a cost on human health. So in summary, I mean, I think the connections between biodiversity and health are very tight, but incredibly diverse, and we're really only just at the point of scratching the surface as trying to, in terms of trying to work out, quantify the true cost of biodiversity loss in terms of its impact on human health. But for sure, it's profound.
I want to switch gears a bit and talk about equity issues. We already know that many disasters, including infectious disease disasters, whether Ebola in West Africa 2013 through 16, or obviously COVID-19 right now, preys upon lines of existing inequities. So in what ways does the destruction of nature exacerbate health inequity? Sophie or Chris, yeah, please go first.
Yeah, sorry, I don't want to dominate the microphone here, but I guess this is a sort of a pervasive issue, I think, through conservation and health in general. We know for sure that there are these massive inequities, and for the most part, the processes that we're talking about in terms of environmental degradation, including climate risk and including biodiversity loss, tend to exacerbate those inequities. So the people at the moment that are the most vulnerable to non-environmental change related environmental exposures, so things like climate and heat and all the rest of it, these are also tend to be the most vulnerable groups in society. And so when those things are changing, then it's those groups that tend to be disproportionately affected, and certainly are forecast to be disproportionately affected as some of this stuff plays out over the coming decades. So absolutely, it's a really central issue. And the other thing that I'd sort of maybe just raise there is that we've kind of realized from maybe half a century of conservation biology and conservation action that it is more or less impossible to leave people out of the the discussion in creating the solutions to conservation issues. So pushing people back to the center of that narrative has been really important for improving the relationship between trying to resolve some of these issues and not making things worse for people that are already in vulnerable situations. So indigenous rights and land use rights and that kind of thing, and promoting human agency and decision making and giving power to people that are so fundamentally connected to nature and biodiversity has been a real sort of sea change, I guess, that I've observed over the last sort of 10 or 15 years in the conservation sort of sphere more broadly. And I think exactly the same thing plays out in health. So that's just a few reflections, although this is really not the area that I'm actively researching in.
Yeah, maybe to add on, so I think I can speak mostly about climate change because that's a bit more my area, but I think all crises, and including also the planetary crisis we're in, always hit people that are already struggling or disadvantaged more. So it's inherently an injustice. I think for climate change, for example, to give some concrete examples, those who live close to roads are more affected by pollution, but these are also tend to be the cheaper flats often because they're loud and they're noisy, and noise pollution also, we know that noise makes people sick. Those who are most struck by heat waves are those with pre-existing conditions, or those living in poorly or very housing that heats up a lot, or those who are isolated, who are living on their own, who have no one who looks after them. Elderly people are often very much affected when it comes to heat waves. And when we look at disasters, of course, those who can recover, who have less to, who can recover less, are those who have less wealth or less things to fall back on their feet with. And especially, I think what is one thing that we have to keep in mind is that it's also pushing people over the edge. So if you had a small farm or a small shop or whatever it is, and you were not rich, but you were getting by and it was okay, having all of this destroyed will push you over the edge of the poverty line. And I think that's what is really, what we really have to keep in mind, and what is really horrible in a way, so that people who have been working and struggling but kind of were okay are then pushed over the edge. And I think, but what a good opportunity is that we can design policies that save nature or are climate friendly in a way to be more just, so they can kind of change this a bit, but we have to, that's man-made or human-made. We have to keep this in mind and specifically design policies in a way that they are just. Because of course policies can go either way, and we can have carbon taxing that is extremely unfair, or we can have some that kind of levels the inequities that were pre-existing. That being said, doing nothing is probably the most unfair option. So there's a lot of action in Germany, or maybe also concern from population that climate policies will be unjust. But I do think we have to communicate that doing nothing is probably the most unjust and most expensive option.
Thanks.
Yeah,
Sorry, go ahead.
I was going to say, just to add to that, I mean, I think the climate space is really sort of pressure testing a lot of this in terms of frontline policy, and some of the stuff that's come out of trying to get a global agreement on climate change has sort of tried to sort through a lot of these issues and prevent that those costs of inequity from occurring, and that for the most part has been a very constructive process, although a very, very long process. It's taken not just a COP every 5 years, there's a COP every year, and it's taken we're in our 30th year of the IPCC discussion, so or thereabouts. So it's a really, really long process, and I guess thinking about where this might play out in other areas. One area that I'm very interested in, not so much on the climate side, but on the land use change side, is the fact that we're really one world, in the sense that global trade connects very, very wealthy countries to developing countries. Developing countries tend to be the primary producers and have a larger share of their population working in agriculture, and therefore being exposed to environmental exposures. And we've done some work showing that in fact this also drives the risk of infection up in exposed agricultural populations. So we can actually trace through, using these amazing databases of trade data, we can sort of see that the levers being pulled, the consumption levers being pulled in a wealthy developed country can have local impacts in a developing primarily agricultural country, and so the area of law around how to prevent those disbenefits from occurring to those people, I think is one area that's pretty poorly resolved at the moment, and in fact many countries sort of accept a certain amount of cost in order to have the income of that, which is beneficial for jobs and things like that, but the full gamut, the full spectrum of impact is really poorly quantified. So these initiatives like sustainable coffee or livelihood friendly coffee or other crops has been a model for how to shift the responsibility and the ethics towards the consumers. And I kind of see that as being a really important area over the coming decade to get some of this stuff that's more linked to land use and land use change under control, or at least maybe minimize the worst of the impacts there.
And to dive a little bit deeper into this topic of equity, Sophie, I know you published an important piece on equity issues related to gender and planetary health. Can you expand upon that?
Yeah, I think gender is one of the areas where we also see that pre-existing inequalities are again affecting the people more. So we know that climate change impacts genders differently. And also, surprisingly, we also saw that in COVID. We often do not research how things affect genders differently. And then we are a bit surprised if they do. And that's the case for climate change. So we know that there will be differential impacts, but often it's not well researched on how exactly. And I think in the area of gender, we also have a lot of win-win solution where we could actually have both gender transformative policies, but also policies that make us stay within planetary boundaries or projects. And often it's only looked at one and the other, and the synergies are not well seen. So there are many different examples of this, but I think the gist of it is a bit that we should be very careful not to try to solve one crisis at a time, but rather to think these together, because we're talking about climate justice, and that also includes gender justice, right? So I think it also contains racial justice and many other forms of injustices that we have to solve. So I think these are probably the more complex solutions, but the most sustainable and just solutions if we keep these in mind. And we know that what gets measured gets done, unfortunately. So that means we also have to measure impact, so to then have more equitable policies in this field.
All right, thank you for those responses. And I want to turn to some of the questions we're getting in the chat in the last 10 minutes. So to follow up on this line of discussioning, are vulnerable people facing a sort of double burden in which they can't protect themselves or are already exposed to hunger or bad living conditions?
Short answer is yes. Unfortunately, that's the case. As we just discussed also a bit, there, of course, we often talk as a positive way resilience, but the less financial means, the less also participation, etc. you have, the less you're able to protect yourself from these impacts. And I think that's why we have to, of course, deal with climate and other natural solutions and problems we currently face, but we also have to tackle the root causes of inequality at the same time, because these always go together. And I think, it's a bit like in public health. Of course, you can take people to behave differently, but if the whole environment is working in a way that they are unhealthy, it won't work. And the same for people when we come to climate change. We can ask them to act climate friendly, but if their whole environment makes it impossible, or even they're even struggling because of climate change to barely get through, this won't be possible. So I think we have to be very mindful of the other challenges and underlying inequalities and inequities.
Do you have any recommendations for Western governments to make them understand that protecting the climate equals protecting people's health?
Do you want to go, Chris, or should I?
No, you're on a roll, Sophie. Go for it.
Okay. Yeah, I think that's what we're trying to do from a civil society perspective, and I think that's also what the research shows very clearly. And I think it's also about telling governments that it's a good argument and that there are win-win solutions, which is what makes your policies accepted by people, which also makes people understand why this is necessary. Yeah, I think in some degree, I think everyone can probably best influence their own government, because the most important thing that you can, or the thing that you have in your hand is your vote, basically, if it's a democratic country. So it's a bit hard to, or it's a bit more difficult to influence on a bigger scale governments. But I think, yeah, it's, I think we've been trying it for many years, or we're very active in this field. I don't have a magic bullet for that, but I think repeating it over and over again, and especially showing what we can win by climate action for health, is probably the best tool we have.
Yeah, maybe just to add to that narrative that seems to have sort of cut through the most is this win-win kind of idea that the benefits you get from climate change mitigation, or in fact adaptation for health, have been sort of shown in many case studies to be almost to the point where it would cover the cost of any adjustments to your economy in terms of reducing carbon emissions. And I think as that, and at the moment that is really based on very, very simple, more or less single or maybe 2 or 3 issues that have been costed. But of course the magnification potential of climate change to affect things that affect our health, the more we cost, the bigger those benefits will turn out to be. And I think this has been one of the most effective arguments in terms of shifting the dialogue, at least politically. And it's unfortunate that we're at that point where it has to be about dollars, but unfortunately that does seem to be the thing that is the primary motivation to adjust policies and things like that. And I guess the reason for that is because governments have to take care of so many different, often competing sectors, that it needs to be very, very clear what the benefits of different policies and actions really are. And I think we've been perhaps a bit, maybe not slow in realizing that, but certainly a bit slow in delivering the science and the economics that can demonstrate those in a way that is compelling politically. The other thing is, it's very often sort of a bit disheartening to kind of see that when there is progress, in this and other areas, and I guess in other areas, the youth activism kind of area, which we've seen has been also very effective in at least putting the issue of climate change on the sort of national psyche and constantly in the news and all that kind of stuff, which raises political awareness and ambition to address it. Sometimes a bit disheartening is to see individual governments responding, on a very short time frame in some of these issues. So a change of government can often lead to a radical change in an entire country's trajectory in terms of contributing to solving the climate change issue. And so I guess, from my perspective, that a lot of that can be solved through concrete law that makes it, that's harder to overcome if there's a change of government. It shouldn't just be a matter of a few people being able to decide these things. It should be part of the legislation and the legislative framework within countries to make sure that these processes have real teeth and they're very hard to undo once they've been sort of put in place. And I see that as one area that could really be help make a lot of progress in future. And that's really starting to happen now. You're seeing legal challenges related to climate and climate change and lack of action, that no doubt there are a lot of people taking note as to see how successful those claims turn out to be. So enshrining some of that stuff in law is going to make that easier for everyone, really, including governments that are having to sort of sort through some of this stuff. And I say that coming from a country that has, I'm Australian, and we have an incredibly bad record in dealing with carbon and climate issues in general. There's a lot of flip-flopping. It's a hugely political issue where it shouldn't be. It should be primarily a scientific issue in terms of the facts, and the basic science should be informing policy. And in fact, it's almost like the other way around at times in the narrative of at home. So that's an area of concern for me, I think.
And we have a final question, which I might take a stab at, which is, do you have any recommendations for humanitarian or development organizations of how they could use their voice to advocate or show more loudly what they want to see in countries where they work? Which gap can they fill? So I'm going to focus very quickly on infectious diseases. And as Chris was saying, most new infectious diseases originate from animals, particularly wildlife. And the drivers behind this include land use change, particularly in the form of deforestation, wildlife trade, and unsafe agricultural practices. And so we have interventions that we can do further upstream to prevent outbreaks in the first place before they even start. Yet, even despite the lessons of COVID, and we don't know the origins of COVID for sure, but there are many, many discussions right now about reforming future approaches to pandemics to increase preparedness and response capacity for the future. But in these discussions, what is being neglected is the role of prevention. And I'm saying this as a physician, someone who's worked in emergency response for over a decade. We are not talking enough about upstream factors that lead to outbreaks happening in the first place. We're not talking enough about why climate change is happening and then the downstream effects of climate change. And so your voices from the humanitarian organizations that you represent, the incredible work you do, you can be very powerful voices to help shift that narrative and provide that upstream perspective that we need to start incorporating, because all too often the reflex response is let the outbreak happen and then let's just let it respond. And we need to shift that model, right? It's about primary prevention. That's the core principle of public health. Let's do primary prevention. And just like in clinical medicine, we tend to focus on treating the complications of hypertension, such as waiting for a patient to have a heart attack and treating them in a hospital. The more effective solution is to go upstream and prevent that heart attack in the first place by improving nutritional access and improving access to medications. We need to do the same when it comes to the topic of planetary health. And so unfortunately, we are now at time. I really want to thank our panelists, Sophie and Chris, for their amazing expertise. I want to thank the conference organizers, and I want to thank all of you